am ready to answer if there are any questions, because the callousness and brutality that we have seen perpetrated against the mentally ill patients in our province does not represent in any way who we are as the Executive Council. It doesn't represent me either, but it happened under my watch. I am ready. I apologize because it happened under my watch. I apologize because it happened when I am the head of government here. I apologize because there are certain things I could possibly have done. I am ready.
Premier, thank you. Council.
Thank you, Premier. We have come to know of the actual number of the deaths of the mental health care users through these proceedings. And as I've said, through the recommendations of the Health Ombudsman. And the objective is obviously to uncover the truth in order to assist the families to reach or find closure in relation to the pain that they had to endure. What the families and the country at large would like to know is there has been mention of your office or your position or yourself as the Premier with regard to the implementation of what had come to be known as the Marathon Project. The families are anxious, want to know exactly what it is that you have known and at what stage. And I would like to give you that opportunity to be able to assist these families by giving an account with reference to a timeline, explaining exactly what did you know of matters relating to life Esidimeni and ultimately the Marathon Project, which resulted in the deaths of the patients.
Thank you, Justice. Let me start by saying that I became the Premier of Gauteng Province on the 21st of May 2014, after the national and general elections in our country, and subsequently appointed the Executive Council. The matters under consideration at the arbitration process came to my attention through the Premier's Budget Council. And I would assume, if I am right, Justice, that MEC Chrissy has canvassed fully what the role of that council is.
Yes, she has.
In December, in November 2014, the Budget Council meeting, which was convened by myself, at which the Department of Health tabled its first presentation in the way our budget process works. And our budget process works essentially on the basis of the technical processes before, which culminate in the Budget Council, with which I chair. Half the time is chaired by me, half the time is chaired by MEC Chrissy. The Budget Council seeks to help our provincial treasury to put together a budget, because putting together a budget is one of the executive functions of MEC Chrissy from the Public Finance Management Act. She puts together a budget, but she needs to make sure that the entire administration participates in that. The budget is put together on the basis of the priorities of our administration. Every department comes before the Budget Council to present its case, basically, and often that case is about, in addition to this, the things that they have always been done, the basic minimum things they have always been doing. If there is money, and I always ask the question to departments when they come. The departments come there led by the MEC, and I think it's very important. The Budget Council from departments, every delegation from the department is led by the MEC, and in that delegation, there's the HOD. And essentially, it's often the senior management team of the department. And maybe this is an additional point I would like to add. So the MEC comes, explains what they have gone through as the department, and any member of the delegation can present their presentation in there. And it is in there that the department, the issues well canvassed here, especially by MEC Chrissy. The department tabled its document, which I know that the arbitration process has had an opportunity to look through that. And the subsequent budget processes, and all of them, I've gone through, all of them kept coming to the same conclusion from particularly all our social departments, to say to them, firstly, we're not we're not cutting budgets. And even if things may become difficult, we must provide core services, basic services. And that's recorded. The PBC at all times, and I am certain that there was no contradiction at any point. At the end, always says, make sure your constitutional functions are not compromised of providing core services. That being the case, and this 2014 budget meeting was followed by several of them coming to the same issues, same conclusion. And I don't have to belay that point, that every time an issue would arise, we would go back to, if you want to reprioritize, it can't be about cutting services. And I have also publicly stated this point during the State of the Province address in 2017, that that's our attitude. The matter of interest to the arbitration process is life Esidimeni. It is important to understand that the department has always brought to, at the very beginning, that is in 2014, there are contracts that they want to review, that they are reviewing, and they mentioned amongst them in subsequent engagements, Selby Hospital, which is a step-down facility, and Life Esidimeni. There are contracts they want to review so that they can look at how to provide these services in a way consistent with what they think they are now capable of doing. And I want to emphasize that the issue of cost as an overriding issue was never the issue, to the best of my understanding. The department would have made this point that, Over time, they have additional facilities, they have additional beds, they have new hospitals, and Justice, I can say to you that in that reassurance, not only once, few times, they would have not emphasized cost, that there are contracts that they think they can review because they can provide those services at a high quality level differently. And I want to emphasize that in the Gauteng provincial government, as the Premier, I don't discuss which service provider a department appoints. I discuss the priorities of this administration, its program, through the Executive Council, through the Executive Council Lekgotla, followed by the State of the Province address, followed by the budget that says this is where we want to go. Departments go into their own internal processes. They do the contract management. The Premier's office doesn't make decisions on contracts. Of course, let me qualify this, that there are contracts in the Premier's office, that the DG in the office, the DG as the accounting authority, and the senior management team will make those decisions. Having said that, Justice, so the public, the Premier's Budget Council, the PBC's message was not confusing at all. It was clear at all times. Followed by that, in November, on the 5th of November 2015, so apart from the PBC process, so where else did I encounter the issue of these contracts? At the meeting convened by me, attended by MEC Chrissy. So what MEC Chrissy may have said to you about the meeting with Nehau, she was in that meeting. The former MEC for Health, MEC Matlangu, the HOD then, who has resigned, Dr. Silibano, were then senior officials in my office. Were in that meeting. Nehau wrote a letter. That letter didn't come to me, and I will explain a system in my office when something comes into the office through correspondence that has to do with the department. The first people who are immediately notified is the relevant department. If it is the matter that has to do with the department, it's the relevant department. And subsequent to that, the administration team sent a letter of Nehau to the department, but the union leadership in the province also sent me an SMS asking for an urgent meeting. The letter would have gone into my office, but they sent me an SMS, and I convened the meeting. The meeting was attended by the General Secretary of Nehau, Mr. Soke, and a delegation from the province. In that meeting, they tabled 3 issues in the meeting of the 5th of November. The first issue they tabled was that Selby contract has been terminated and there are workers who have lost their jobs. That's the step-down facility. At that time, it was terminated already, and that they would like to discuss that. The second issue they raised was that they know that live Esidimeni contract will be terminated from their interaction with the department, and that it is in that meeting that, so not that I didn't know about, and in my State of the Province address I make this point, that there was an intention on the department to review contracts, but it is in that I knew, because they said there is a way they are going to provide these services through internal capacity. In that meeting, it was brought to my attention that, because they were there, that a letter has already been communicated to the union, to Life Esidimeni. It is correct that out of that discussion with the third item the union had put on the table was the future of private health care in Gauteng. NEHAWU is, I need to declare here, Justice, that NEHAWU is a union from which I came from. I used to be a Deputy General Secretary of the union, so I also know their own policy positions very well. I must declare that. That it's not like it's discovered somewhere else. I was an Education Secretary of the union. I used to train shop stewards there, and I became the Deputy General Secretary a few years before I became the Premier. So I also know their position, their attitude to the issue of private healthcare institutions and public healthcare institutions. The key thing on that day was they said there's already a contract terminated. There are workers who have lost their jobs. There is another one that is going to be terminated. Workers will lose their jobs, but they also want to discuss the issue of policy. And I, at the beginning of the meeting, I gave an opportunity to the MEC to brief us, and the MEC said she has been engaging together with the HOD, the unions, with regard to the intention to insource. And I know that this word insource has been used a few times. The intention to bring into the public sector, because according to her, the department is capable of providing quality services to not only to the mental health care users, but because Selby was a step-down facility, that there's additional capacity. And she said she and the HOD had been engaging with the union, and they basically don't understand also why the union is panicking. They've been engaging.
Premier, from what you have just been testifying on, like you have indicated that the meeting was on the 5th of November 2015.
Yes.
Can you just clarify the point whether, from your evidence, you have mentioned that NEHAWU raised concerns that through its interaction with the department, they were informed that the contract was going to be terminated. Can you just clarify if you were fully aware that, in fact, the contract was already terminated at that time?
I did say, Council, that it is only at that point, at the meeting of the 5th, that what I knew was the discussions that the department has brought to those previous meetings to indicate their intentions. But the union made it very stark. I mean, the union put things like that. A decision has already been taken. Life Esidimeni has informed us that the department has actually served them with the letter that the contract, and that's the letter of the 29th of September or 27th September. So it is only at that time. The Justice, the conclusion of the meeting on Selby was an issue that was a done deal already. The department had driven bringing those patients who were in Selvi into the establishment, and the only key issue at that time was the remaining ones who were in life Esidimeni. And the reassurance from the department was that essentially they were saying how the union, this issue of insourcing and coming from the unions myself, I kept asking the department, does NEHAU know that what you are doing is to bring this service into the public sector and that you have a capacity to provide that service? The department said, yes, we have been. So MEC Chris is right. That reassurance took place there again, that we have a capacity to provide this service in-house. We will be able to. So the next important thing...
But the reassurance was provided by...
the MEC and the HOD.
MEC and the HOD.
Yes, they were the most senior officials.
And HOD...
Dr. Silibano.
Dr. Silibano. Thank you.
They were the most senior officials representing the department at that time.
And the assurance was that they would take them to existing provincial facilities.
Yes.
Yes.
And there is an addition, Justice, that in some of those PBC meetings they had, that they were working with the Department of Infrastructure Development to also improve some of their community health centers, that they will be ready. And I want to emphasize, so in the meeting with NEHAU, there was no issue about the NGOs, as it was in the earlier meeting with the very first meeting in 2014 of November. And I certainly would know that NEHAU would have taken a lot of issues with that, apart from the fact that I myself, as I said in the State of the Province address, once the issue of the NGOs came, I would have worried a lot about their capacity versus not compromising service, unless if it was the existing ones which were already providing good quality service. They would have had to reassure me.
Because taking healthcare, mental health care to NGOs would certainly compromise jobs, wouldn't it?
Yes. Especially if those hospitals were closing down, certainly. So the first primary concern was about the quality, continuity, if what you would call business continuity in another language. The quality of service that the department would be able to provide, that reassurance was there. And secondly, in the light that they are going to move this work, the patients, the mental health care users into different institutions, they would definitely need additional staffing. And that's how the issue of the exact number that there's 300 and something, 300 and, I don't know, I may not be that accurate, maybe 374 or 377, especially from life. That's where the issue of this, the possibility of absorbing those workers into the new service that's going to be provided in-house was not unrealistic. The conclusion of the meeting on that issue, I was chairing the meeting, was that the MEC and Dr. Silibano would continue, because they were saying, we have no problem with NEHAU. We don't know, Premier, why you should be coming in. That was also a reassurance to me. We will continue to meet with NEHAU. The issue of which ones we can absorb will also be based on their skills and the requirements in the in-house service that we are going to provide. The conclusion of the meeting was not an instruction. It was they have been working well. That's the assurance they gave to me. They are going to discuss to see And then the House said they'll provide the full list of those workers, and they are willing to subject them to an assessment of which ones will be able to meet what requirements.
We know now, Premier, excuse me, that none of all that happened.
Certainly, Justice.
The MEC, HOD, head of mental health care, went straight ahead after those assurances. They shut down Life Esidimeni. The workers lost their jobs. They shunted out the patients from there in a massive hurry and deep inhumanity. So the promises they made to the Premier's Budget Council and subsequently to you and other colleagues in the Executive Council were breached almost immediately after the meeting of the 5th of November.
Yes,
and one
Justice.
would sit and wonder what to make of that.
Yes, Justice. That was not to be the case.
And what would have moved the MEC to go out there and do the direct opposite of in-house institutionalization if there was a distaste for private health care? But that did not happen. People were parceled out to NGOs.
Justice, that's a very important question. I can move to the next timeline where I ask them that question. And that's, unfortunately, as an after effect when people have already died. And at that time, we have the health ombuds, who I have a great deal of respect for, Professor Makhura. That's why it was no difficulty for me to accept his report without reservation. I have a great deal of respect for him. That's why he says, so by the 14th of September, I convened a meeting with the MEC, the HOD, and a team that came from the Mental Health Directorate. And this comes, the 14th is important because on the 13th, the MEC answered a question in the legislature. And that's when she said there are 36 mental health care users who have passed on in the NGOs, who have not only passed on, who have passed on in the NGOs. And I convened that meeting the following day. I wasn't in the legislature on the 13th. Justice, I do, amongst the many things I do is an outreach program to go to factories and go to communities as part of solving problems. I was in the factory in the Val, meeting with the private sector, as I always do, and my spokesperson, Pumla, came to me to say there's just been an answer in the legislature. The MEC says that 36 people have died. And I phoned the MEC and said, we meet tomorrow. I want to meet you with your team to explain what has happened with the death. That's the 14th of September. That is now 2016.
And that's 2016.
Yeah, that's as an after effect.
Yeah.
So there were two main questions I asked in the meeting. The first one is the one you have raised. Firstly, I said to them, how many people have died? And secondly, how did they die? It was out of that discussion, it is clear, and this matter is canvassed well by Professor Makhura in his report, that even in that meeting, and I have a report that Justice, should you be interested in that report, I'll give it to you, where they table all the numbers of deaths and they say over time people have, and this point they also tried to canvass with the health ombuds, and he didn't buy the story. I must say that. that people have been dying at life Esidimeni, and the numbers have been huge even there, and this is the quality of service there has not been good. And then the second thing after, so what was...
In fact, Premier, they were saying people die.
Yeah, it was...
They were saying this is
it's
natural
normal.
causes, it's normal.
Almost like, yes, normal. There's
People
nothing...
die, and Dr. Manamela came and told us that. People die. MEC Mashango came and told us in evidence in chief, people die in mental health care, almost like it was normal.
Yes, that was normalizing that said situation. So they put together all these numbers. There were also professionals there. I must say that the chairperson of the Mental Health Review Board, Ms. Masondo, was in the meeting. And I think when she came here and said the Premier was in those meetings of the Marathon Project, she was confusing herself or trying to confuse you and mislead people here. That is the meeting of the 14th of September I was in when I was wanting answers from them. How many people die? How did they die? She was in the meeting. And I can say that she's amongst the people who gave an explanation that we now know that it is not the truth, that they were actually... So in response, because I can't go into the numbers, they were not sure, and that record is there. In response to how did people die, and I say, how do they die in NGOs? If they died in the hospitals and these government facilities, which is where you said when you are moving the services to, we would really be worried that it means the quality of care you promised you could provide in-house, it was not there. But it's worse still, people died in the NGOs that now we know they were not only ready, they were not only unready and ill-equipped, but they were also unlawfully operating. So I asked them that question. And this is where the issue of the Mental Health Care Act implementation comes for the first time. On the 14th of September, they say they were under pressure to implement. Now, there was the story that they were under pressure from Treasury on the budget. And I know in all those meetings and MEC Chris has canvassed that point. That was not the case. There was another story in that meeting that now they were under pressure from National Health Department to implement what is said is called deinstitutionalization. So that's when I was asking, but in NGOs, they said, yeah, but the Mental Health Care Act doesn't allow us. We couldn't take people into our health establishments because the people must be, because deinstitutionalized, it will work against deinstitutionalization. So in the quest of the truth, the families are not the only ones who have been trying to get the truth, and it takes a bit longer to get behind those things and then find out. So they say they were under pressure, and MEC Chrissy has made the point correctly that if it was an implementation of a national government policy, all the MECs in Gauteng come back to the Executive Council. If there's a national policy we must implement, which has new cost implications for us.
Premier, is there any way in which you could have monitored the affairs of the Department of Health in order to avert the tragedy from occurring?
Council, may I conclude just one part
Yes.
of my testimony, which is important before I come to that. And to deal with this issue that for the arbitration process is important about, I'll come back to the issue you are raising. Because the deinstitutionalization is one of the three reasons that are given. The first one was pressures, budget pressures. The second one was the AG's report. MEC Chrissy dealt with the first one, and the second one competently. She didn't quite know much about this one. I would know because out of that interaction, I said, okay, so they are saying they were doing something, so I can understand. But okay, MEC, why didn't you come and report? But out of that meeting,